Hello, everyone. Hope you're doing well. This is the lecture for Chapter 4. But we're also going to have some information in here about Chapter 3. And I know it's a little confusing with the change of the book. So we have a new edition book which has chapters in different locations. I just want to say some of the lectures that I had for the other book are still relevant, and I'll still include them. However, for this week, I'm recording a new lecture because there is some differences. And this week, we're mainly talking about verbal communication, but that is included, of course, in Chapter 3. And then you have listening and learning, which is included in Chapter 4. So that's your reading material for this week, Chapter 4, 74 through 100. And then also, I'd really like for you to make sure you pay attention to the Robert Rules of Order, which is, a part of verbal communication in a meeting setting. I think it's really important. We'll go over effective meetings again in the future, but I think it's important for you to read over those highlights that we included there in a couple of videos because it just shows verbal communication when it's succinct and done the right way. On that information, let's look at what the definition of verbal communication is, the purpose of clear language, effective verbal communication with patients, of course, because that's going to be your job, including content, word choice, grammar, how you pronounce things, your tone, right? Tone's very important. And then emphasis and small talk using potential commentary. So when you're a provider, right, you want to make sure that you send a clear message to patients. If you're communicating with patients using verbal communication, of course, has to use standard English language and not slang. There are interpreter services that are available, but those are usually highly regulated in healthcare settings, so be aware of that. Sometimes that can be a challenge, but healthcare systems do everything that they can to make sure that people are communicated with in the manner that they understand. Medical jargon is not something you want to use around patients because it's not something they're going to understand, and sometimes it can be really confusing. So you want to be clear and succinct to the patient, especially if it's a diagnosis or a challenging thing that they're hearing for the first time. And be a good listener for the patient, right? Hear what their complaints are, hear what their concerns are, and then also be willing to take feedback that they give you. So paraphrasing is super important, especially when you're talking to patients. You want to provide a repetition of what they say back to them. So paraphrase what they say back to them. So if someone says, my heart hurts, I'm having chest pain, you repeat that back so you get that clearly. And a lot of times this will help you in documentation in the electronic health record. Empathy and understanding is also very important because that's how we should live our daily lives. And in healthcare, it's super important because they rely on us to care for them. So providing empathy and sympathy is very essential in the healthcare setting, and it's something that if you don't do, it will be noticed. Some do's and don'ts of verbal communication. Make sure you use the patient's name, especially when you're entering the patient's room. Don't interrupt the patient. Don't give advice unless it's something that they ask for, or if you're a medical provider, right? You want to give exactly what the provider says. If that's the situation you're in. It all depends on your license, right? You might go finish school here and go on to be a doctor one day. Of course, at that time you can give advice, but make sure that you're legally okay to do so. Um, don't tell a patient how you think they should feel, right? The patient's going to feel a certain way no matter what, and you want to be able to remedy that and help them in the situation that they're in. 5 components of listening: hearing, interpreting, retaining, and recalling, right? This is in chapter 4. 5 components: hearing, interpreting, retaining, and recalling. Remember what people say after they say it. Super important. I like the dog picture here because, when a dog tilts their head, right, they're listening. So they're doing what they can from the end perspective of hearing, interpreting, retaining, and recalling. Uh, Although they don't often interpret what we say, but they try. Some barriers to listening might be physical hearing problems, not concentrating on what's being said, so kind of ignoring what's being said, um, or being distracted, right? Being distracted by other things that might be going on. Talking instead of listening. A lot of people have a problem with this. Listening is some skill that you have to teach yourself over time. and then having preconceived thoughts and opinions, so thinking something before it's actually even a fact, and then not being interested in what's said. So, that can happen at times, especially if you're in a lecture or something and it's not something that's interesting to you. It can be a barrier to your listening because you might be thinking about something else. So focus on the message. Make sure you don't blame the speaker. It's your responsibility to interpret what they say. Even if you don't agree with it, try to find something positive in there. Try to learn something and take it back to make you a better person. Difference between empathy and sympathy. Empathy is feeling what another person is feeling, and sympathy is being aware of their feelings and feeling sadness or pity. So know the difference between those two. And we got a lot of slides, so I'm going to try to get through these. How do you control noise? Of course, this is obviously pretty clear. Turn the TV down. That happens a lot. Use earplugs around noisy machinery, especially in radiology, right? And then internal filters. Make sure you resist list while listening, right? Make sure you have filters in your head to try to get those things out so you're paying attention to the presentation. Try not to talk. Make sure you listen with your full heart, right? That's really important. Dampen preconceived notions. So don't have a preconceived idea before you go in, although everyone has a preconceived idea of just about everything. So my recommendation is when you go in, don't be hesitant to change that idea based on information and facts that you hear. Watch their body language. So body language is really important facing the speaker. The speaker can have body language, but you can also have body language. So what feedback you give the speaker is really important by where you're sitting, taking notes, crossing your arms, nodding when they say things, and trying not to do other things while you're supposed to be listening. Don't ask closed questions in relation to listening. It should be open questions. So closed question would be like something, how'd you like the presentation? Of course, that would be a closed question. So you want to ask open questions. What did you think was best about the presentation? And then people could go into what their thoughts are in regards to how it went. But you don't want to ask closed questions. That's a part of communication and a part of listening. So this is just an example in relation to radiology. We're not going to go into it, but you can think about this in relation to open and closed questions. Of course, a little bit more here about the history. Another open and closed question, communication outline. And then also, it talks a little bit further about how you communicate with patients in relation to getting the full picture, right? You want to ask them how, when, where does it hurt? Do you have numbness here? Which side? You want to go into detail that's needed, especially if you're looking at it from the perspective of a medical assistant or a nurse. A little bit more about the history. Same thing here. We're going to skip through these. You're more than welcome to look through them in the PowerPoint, and it gives you kind of an idea of how to communicate further and better with patients. Same thing here, urology example and an abdomen example. So I'm going to scroll up one more time and talk a little bit about focusing on the message. We went over this a little quickly, but as you're in school, right, you want to make sure that you focus on the message at hand. A lot of times, you have a lot of different competing priorities with different classes. So focusing on the message is super important in relation to prioritization, right? So you want to focus your time and effort in the moment that you're at. I see too many students walk into a class and they're thinking about math before, and they're sitting in communications and they're not really focusing on what they need to focus on in order to be ready for the final exam. So if you take the time that you're in and commit to the time that's outlined as usually the school outlines for you, I think you'll be better off. When you get into the world, right, and you have a job, you're going to have to do your own scheduling for yourself. But the school where you're at has done a really good job of outlining your day based on hours throughout the time that you're at school. So take that time and those hours to study diligently and be 100% committed to the class that you're in at that time. It's very important. All right, I'm going to switch to a different topic really quick, and we'll talk a little bit further. This is a little screen. I apologize for that, but I'm going to hop into the course, right? Remember, check-ins will be here at the announcement section, but we're going to go into course content really quickly and hop on over to week 3. All right, now that we're in week 3, you see the PowerPoint slide here that you can review. That's really helpful. Here's what I was talking about in relation to Robert Rules of Order. So how meetings work, how efficient meetings work is super important to the diligence of, thinking about this from the perspective of how do I get verbal communication to be efficient in a large group setting. This shows you how to do it. This is a great example of how verbal communication, especially when you have a lot of people, can be effective. However, it can also be ineffective when you have a lot of people. So if you don't have rules outlined like this, then there can be challenges. You only have one due item this week, and that's the discussion board. So be sure you do that. It's interpreting communication number 2, right? We're talking about the rest of chapter 3 and chapter 4. But in relation to how meetings work, be sure to watch this video. It's really, really cool. I think you'll get a lot out of it. Further, make sure you study the material that was given in regards to the PowerPoint and read the chapter, and after that, you should be set for this week. I appreciate all your efforts, and if you need anything, don't hesitate to reach out.